Good morning. My name is Dottie Gallagher, President and CEO of the Buffalo Agri Partnership. Welcome to session number 3 of the BNP's Preparing Your Business for COVID-19 Vaccine Series, presented by Highmark Blue Cross Blue Shield. The BNP thanks our presenting sponsor, Highmark Blue Cross Blue Shield, for helping us bring this important conversation to our business community. This is the third and final session of our series, and today's conversation will focus on how to best communicate with your employees and customers about COVID-19 vaccines. And as I said in the previous 2 sessions, we know that COVID-19 vaccines save lives, can return a greater sense of normalcy to our community, and will allow our region and economy to fully reopen. We also know that the business community and individual employers have an opportunity to lead in the regional vaccine effort as a trusted voice for people considering getting a vaccine. To that end, we developed this series to help employers create a clear COVID-19 vaccination policy for employees, part-time workers, temporary workers, and contractors that encourages vaccination, reduces barriers, and makes it easy for them to get vaccinated when it's their turn, and now it's everybody's turn. Communicating with employees, workers, and customers about the safety and benefits of COVID-19 vaccines, and reinforcing the importance of masking and social distancing to prevent the spread. We want to help create a safe workplace culture where all workers feel supported and strengthen vaccine efforts in the regional community. In sessions 1 and 2, we discussed the steps all companies can take to show the efficacy of the available vaccines, to show the importance of enabling an internal team to coordinate your vaccine plan, and then formalizing that vaccine plan as a company policy. And why are these steps so important for employers to take? Well, while we are in a slightly better position than we were a week ago, Western New York still leads the state in positive COVID-19 cases. The vaccination rate is slower than we originally hoped for, which ultimately will slow down our region's full eradication of COVID-19. Our challenge is not access any longer to the vaccine, but rather getting enough appointments made and shots in the arms to reach herd immunity. There are many open seats that are at these vaccine clinics right now, so we know this is a real challenge. COVID-19 clearly dominates the public consciousness, and there's a lot of misinformation and conjecture that have influenced individuals and community response to the pandemic, and now the vaccine strategy that's meant to eradicate it. According to the 2021 Edelman Trust Barometer, 72% of Americans trust their employers on a range of issues, including the pandemic. The creation and communication of thoughtful and inclusive vaccine strategies based on facts and current resources is the very best way to help employers, the best way for employers to help end COVID-19 and keep our region safe and our neighbors employed. We encourage everyone to visit the COVID-19 resources and impacts page. I apologize, at thepartnership.org to view sessions 1 and 2 of this series and for updated information on vaccine access, education, policy, and communication. And if your company needs specific guidance or assistance, please use our BNP business link on our homepage to ask your questions, and our team of experts will contact you with a response to your particular concern. While on our website, please look at our wide range of other upcoming events, including the BNP Speaker Series, Building a Security Culture session on May 7th, and the BNP 360, How to Effectively Lead a Remote Workforce session on May 19th. Your feedback on our events is important to us. You will see a link for an event survey in today's session, in the chat section. We'd really appreciate it if you would click on and let us know what you think. And if you complete the survey, you may win one of our It's Our Job small business kits that include face covering, signage, and social distancing markers to help your business operate safely. Today, we are fortunate to be joined by Chuck Hayes, Vice President of Marketing and Communications for Elderwood Administrative Services. Chuck provides leadership and direction for marketing, public relations, and corporate communications for Elderwood and its affiliated companies across 6 states. He also brings 2 decades of healthcare marketing experience to this conversation. Later in today's presentation, Chuck will talk about Elderwood's Because I Care campaign as a way to use communication to reduce their staff's risk of contracting and spreading COVID-19. We will close the meeting with a Q&A session with Chuck. You'll see a button at the bottom of your screen. Please type your questions in there. And if you see a question that you is similar to the one you want to ask or that is of particular interest to you, please like it so it will rise to the top of the list. We do ask that you enter your name in the required fields if you are asking a question. Before we discuss communications, let's go over the important questions we frequently hear from employers. These answers are supported by the U.S. Equal Employment Opportunity Commission as well. Can employers mandate vaccinations? Yes. Our goal is to help create vaccination plans that yield voluntary appointments, but employers can legally require employees to get vaccinated with two very important exceptions: religious objections and/or medical conditions. Can employers ask for proof of vaccination? Yes, they can. Please keep in mind when you're asking for this verification, employers are citing the allowable exceptions are entitled to confidentiality. Can employers ask for advance notice of vaccination appointments for scheduling purposes? Yes, they can. Employers are still responsible for scheduling the workforce and are legally permitted to ask for advance notice of these appointments. Per the New York State COVID-19 vaccination leave law, do employers need to provide 4 hours of paid leave for each vaccination appointment? That answer is yes. The state's vaccination leave law is effective until at least the end of the calendar year and provides 4 hours of leave for each vaccination appointment for every employee, both full and part-time. Are the appointments that are scheduled on weekends or after work hours covered by the law? These are not. The state law only applies to appointments made during an employee's scheduled workday or shift. Are some employers eligible for a federal tax credit associated with this paid leave? Yes, they are. Businesses and tax-exempt organizations with fewer than 500 employees can receive a FICA tax credit for providing paid time off for each employee receiving the vaccine and for any time needed to recover from the vaccine. Is there employer liability associated with on-site vaccination? No. If we are presuming a voluntary vaccination pod on your site, individuals getting vaccinated are completing consent forms and the employer itself is not administering the vaccine, any additional liability is unlikely. Staying with the topic of on-site vaccinations, the BNP is helping facilitate on-site vaccine points of distribution or pods for interested employers. Last week, we launched a vaccination clinic interest form for businesses that are considering a pod, and a dozen or so businesses have already stepped forward. We are working closely with both governmental agencies and regional pharmacies to help create these opportunities at work sites. Please visit thepartnership.org and click on the icon you see here on the slide to complete the intake form. Creating a communications plan for vaccination can be broken down into steps and tactics designed to educate and encourage employees and customers. While some of the steps may seem obvious, our region's slow vaccination rate highlights a disconnect that employers can help correct. So as with creating a vaccine plan and policy, your communication strategy must be clearly shared with defined goals and steps. And what we're sharing with you today is the result of best practices and research that we have culled from various important sources. Step 1, designate a communications lead or team. Be sure to consider including someone who is a trusted and designated source of information on health-related issues, such as the chief health officer if you have one in your company. And if you're a smaller company, considering empowering a staff member or team that communicates with your employees and customers on a regular basis. The second step is to develop a communications plan. Having a written plan along with the timeline really ensures there's a rational and steady cadence of communication to employees and workers. Most people need to hear messages several times and in different formats for the information to fully sink in. And I'll add that those that are vaccine hesitant in particular need to really understand the facts that we know are true. Step 3, customize communications for workforce populations who may have unique needs, concerns, or questions. There are a wide range of tactics you can use to educate your workforce about the safety and efficacy of vaccines. Think of it as a surround sound of messaging to reach the most people and to remove most barriers to vaccination. This is a screenshot of the vaccination communications section of the BNP COVID-19 resources and impacts page. We have compiled several communication guides that include templates, signage, sample correspondence, scripts, and multilingual tools that will help share your vaccination message quickly and effectively. We also found that these 10 tips provided by the Health Action Alliance are good when making decisions on how and when to share your vaccine message. So we'll go through them now. The first is to identify your audience and plan to communicate as broadly as possible across your workforce. Think about everyone you are trying to reach within the organization, as well as their varying levels of understanding and enthusiasm for or concerns about COVID-19 vaccines. Do not assume high levels of general health literacy and avoid scientific jargon. Instead, use plain language so the information is clear and easy to understand. And again, we have some samples on our website that you can download and use, and some great materials actually provided to all employers by Highmark that are on our website as well. Second, consider how employees and workers get their information and plan to deliver these messages across multiple communication platforms and to do it multiple times. Email communication is key, but don't forget to consider employees and workers who might not have regular access to email. Consider the universe of tools and strategies you must to reach everyone, and consider that most people need to hear this message multiple times. Choose tactics that will educate and encourage. There are a wide range of tactics you can use to educate your workforce about the safety and efficacy of vaccines. While we will go over specific and inclusive examples both later in our presentation, and I will add here that that within specific audiences, there are messages that resonate or don't that have been tested with research. So I would encourage you to read those, the best practices that you can find on our website. One of them, and this is the next tip, is to lead with empathy and ground your communication in company values. It's important to acknowledge that employees and workers may have questions about vaccines, and that's okay. Acknowledge these concerns and questions without trying to invalidate or challenge them. And of course, avoid condensation, lecturing, and negativity. That won't get us anywhere in getting those that are hesitant to be comfortable in getting a vaccine. Be direct and transparent. Will COVID-19 vaccines help you work better together, allow your employees and workers to get back into the community, ensure that your services that you provide are safe, let your people do the work that they love, making a connection between company values and why your employees should get the vaccine will help those employees feel more comfortable and get vaccinated. Facts about safety are key, but emotional triggers are equally important. Don't just say the science is solid. Explain that vaccines are authorized by the FDA. That means they've met the agency's strict rules for being safe and working well, as shown in clinical testing. These vaccines have been studied in clinical trials with large and diverse groups of people of various ages, races, and ethnicities. Systems that allows the CDC to watch for safety issues are in place throughout the entire country. And as we saw with the recent pause in administration of the J&J vaccine, these systems can detect potential problems. We know we need to manage expectations here. COVID-19 vaccines are one of the many important tools to help us end the pandemic. At the same time, we need to continue wearing our masks, keeping our social distance, staying home when we're sick, and washing our hands to keep everyone safe. Vaccinated employees and workers should be reminded that they may still be able to transmit the virus to coworkers, customers, friends, or family members. Therefore, it's important that everyone continue to follow CDC and New York State guidelines to prevent the spread. Don't ignore that there are side effects or diminish or exaggerate them. It's normal to experience some mild discomfort following vaccination. This is a sign that your body is building a protection. I'm vaccinated. I had some very mild side effects, as well as many other people have. And some people don't have them at all, and some people have them very, very well. So being open and honest about side effects helps build that trust with employees, workers, and other stakeholders. The CDC offers comprehensive information, again, available on our resource and impacts page about what to expect after getting a COVID-19 vaccine, including the common side effects, helpful tips, and guidance on when to call your doctor. Expect questions, listen, and provide a mechanism for employee feedback. Employees and workers may also have questions about company policy and their healthcare benefits, as well as return to work questions related to the vaccine. Make sure you have mechanisms in place to field those questions and feedback directly from your employees and workers so you can quickly address concerns. And be thoughtful about your messengers. While hearing from the CEO and leadership is important in setting company culture, the message can't only come from the top. Work to cultivate trusted messengers who reflect diverse communities within your workforce and can speak to their unique concerns. Trusted messengers might include informal leaders in your organization. So work to ensure that these messengers have the ability to do as much listening as they do speaking. Celebrate and normalize getting vaccinated. Invite employees and workers who are comfortable to share their vaccination experience informally among their networks or through an internal communication strategy. At People Incorporated, as an example, on every screen when employees log in, they celebrate people who have gotten their vaccines, and that's a really great way to communicate that. It's often helpful and encouraging for people to hear from their friends and peers about what an experience is like. And in fact, the surveys have shown that many people are waiting to see how vaccination goes for others before deciding whether or not they're going to get vaccinated. But be sure to keep it voluntary and to protect the confidential information of your employees. Here are some examples on how you can put those education tips into action with easily downloadable examples found on our COVID-19 resources and impacts page. Distribute a CEO letter to employees and workers sharing basic vaccine facts. Our site includes an example from the Health Action Alliance as well as text we drafted for our region. Use your employee intranet to share vaccine information and answers to frequently asked questions and explain myths and facts. And explaining the myths and facts, one pages about the vaccine and multi-language versions are also available on our website. Organize vaccine education and listening sessions with employee leadership group to better understand their unique needs and concerns. Use your social media to share facts and links to trusted resources. News about vaccination access changes quickly, so you can send text messages to employees with vaccine info and updates. Ideally, our vaccination strategies create buy-in and employees choosing to schedule an appointment. As with other employee engagement campaigns that we all have experience with, encouraging employees to get vaccinated might include asking employees and workers to take a pledge to get vaccinated. Research shows that a strong correlation between signaling intention and following through. Organizing employee town halls and Ask Me Anything sessions with public health experts and company leaders that can be used to share information and offer encouragement. Creating blog posts and newsletters can both share information and offer encouragement, especially when sharing personal testimonials from vaccinated employees and workers. Posting workplace flyers and posters. Our site includes digital tools from our It's Our Job campaign. We have a new poster there specifically about getting shots, as well as CDC and Ad Council materials. Consider posting these accessible and visible information around the workplace to reinforce your message clearly. The steps and resources that we've discussed today and throughout this series are based in medical research and compliance with all levels of regulation. As I stated at the start of our presentation, employees trust their employers on the topic of vaccination. Our job is to share this information accurately and effectively while removing any barriers to vaccination that we can responsibly. All of the research shows across the board that people who are vaccine hesitant, the only way to encourage them productively is by someone who they have a trust relationship with, whether it's their pastor, their doctor, and employers do rate very highly on that list of trusted advisors. So that's why employers have such an important role in actually closing the gap and to get it to herd immunity. It all starts with trust. Now we get an opportunity to learn from an industry leader that is executing a vaccination plan on a daily basis in our region. Elderwood is a leading provider of care for seniors in the Northeast and Mid-Atlantic states. They offer a wide range of services across a continuum of high quality facilities. Elderwood is consistently recognized for quality and value. Chuck Hayes is Elderwood's Administrative Services Vice President of Marketing and Communication, bringing 20 years of healthcare marketing to today's session. Chuck is going to talk about Elderwood's approach to vaccination communication and what their company is learning along the way. Chuck, welcome and thank you so much for being with us here today. I'll turn it over to you.
Good morning, Dottie. It's a pleasure to be here and very happy to be part of this important initiative. It's incredibly important to getting back to normal, and in our particular work environment at Elderwood, it's keenly important for our employees to be vaccinated. Next slide, please. Many of you are familiar with Elderwood because of our presence in Western New York with our senior care continuum. We have independent assisted living and skilled nursing facilities. These span not only Western New York, but also Vermont and Rhode Island as well. Our organization is actually much more complex than many of people in Western New York may be familiar with because of how widespread the organization is. In addition to our senior care facilities, we have pediatric, residential, and medical daycare facilities in Pennsylvania. These serve medically fragile children who are often technology dependent for life support with chronic conditions. We also have Woodmark Pharmacy, which is an institutional pharmacy operating in New York, Massachusetts, and Connecticut. We also have a managed long-term care plan, Elderwood Health Plan, which operates in 5 counties here in Western New York, a home care agency in Massachusetts, and our administrative support services operations, both here in Buffalo and a smaller operation in New York City. So all told, we have more than 4,000 staff members across 6 states and in 9 unique settings. So internal communications about anything, let alone something as important as this, is both complex and challenging. Next slide, please. So as you can imagine, we are a highly regulated industry, and there are 2 key regulators here in Western New York that I'll speak to, and that is the New York State Department of Health. They are probably our primary regulatory authority, especially for our workers in our patient care settings, and the Erie County Department of Health, which all of the employers here in Western New York deal with in times of crisis like this. And that's more of a secondary regulatory agency. So we work in concert with these, as well as the Centers for Medicare and Medicaid services. Next slide, please. So going into a vaccine campaign and the challenge of getting our staff vaccinated, we were dealing with an already burdened workforce. Going back to the very beginning of the pandemic, there were a number of uncertainties. We were dealing with a new contagion, although our teams are deeply rooted in best practice infection control. This is something entirely new that we were dealing with. It was highly contagious, and it was not fully understood. They were also dealing on March 11th, our organization shut down visitation a day after, or a day before rather, that New York State mandated that visitation restriction. This creates a great deal of stress, both for our residents and even more so really for the families who are by extension another customer of ours. And our staff was dealing with that family stress as well. Work from home. So as we dispersed our administrative services teams, that was new for many of those staff members, and we encountered a number of technology challenges. We didn't have a lot of mobile devices deployed for those teams, so we needed to act quickly to do that in order to facilitate work from home. In our healthcare facilities, we began to be mandated for daily, well, actually everywhere, daily health screenings. But in our facilities, we had mandatory testing for all of our staff who were working in those facilities. And that was 2 times per week for our full-time workers. I'm sure many of you have had a COVID test. It's not a particularly pleasant experience. And all of our staff had to go through this twice a week for all of our full-time workers, at least once a week for our per diem and part-time workers. And additionally, our staff, which has been well chronicled and well documented, and you've seen all the images, dealing with that full-time PPE requirements, dealing with outbreaks in certain facilities. And then as new knowledge became available and as the pandemic evolved, there were changes to guidance that really happened quickly. So the state or the CDC or CMS, all of which have purview over our industry, could issue new guidance at any time. And quite honestly, it was expected to be implemented immediately. So our teams were really caught in a bit of whiplash sometimes with all of that. So we had a lot to deal with. Next slide, please. So with all of that, our staff was really dealing with incredible information overload. So with those changing guidelines and with the new scientific evidence that our clinical workers were presented with regard to the pathology and new treatments that that had developed, keeping up with understanding those was a challenge, and there was a lot to digest. Internally, we had weekly, if not daily, policy and procedure changes. So as we learned, we adapted and adopted and implemented quickly. But this meant communicating these things quickly and getting our staff to understand and comply with those policy and procedure changes. And then outside of work, people are dealing with all of the traditional media and social media, as well as all of their family and friends who tell them, oh, well, you work in a nursing home or you work in an assisted living facility, you must know about X, Y, or Z, or tell me about this or that. And it was just a never-ending thing for our staff. So there was a lot thrown at them. It was like drinking from a fire hose most days. So there's, as a communications effort, we were dealing with a lot of different messages that had to be communicated, competing priorities, and a challenging communications infrastructure. Next slide, please. So the first question we had to answer was to mandate or not. As Dottie pointed out earlier, it is an option to mandate the vaccine for employees. At Elderwood and our affiliated companies, we believe that healthcare decisions are highly personal. And we thought as an employer, it was important to respect the decisions of our staff. The other key factor in our decision to not mandate so far, and that's actually a decision that's an ongoing thing that we reflect on. It's never off the table. So we weigh the benefits and risks, but mandates are not universal. There's nothing in the healthcare industry that says every healthcare worker must get the COVID-19 vaccine. And in our sector of the healthcare system, it's more transient than others. So we have a risk of staff leaving for other providers if they object to the vaccine, because everybody is aggressively recruiting staff. It's a challenging time, and for those staff who are really opposed either on personal grounds or political grounds or medical or religious, whatever, if we had issued a mandate as a condition of employment, there is concern that we could lose staff to other employers. Next slide, please. So as we look at it, going back to a survey in February, which seems eons ago in times of COVID, but that's some of the best data I could find. Who's willing to get the vaccine? So looking at only 31% of female healthcare workers said that they would be willing to get the vaccine as of February. These numbers may have changed. Only 19% of Black healthcare workers indicated they would, and only 30% of Hispanic healthcare workers indicated they would be willing to get a COVID-19 vaccine. So if you look at the senior care workforce, we're made up primarily of young female persons of color. So we are right in the sweet spot of vaccine hesitancy. So in addition to everything else we laid we have a significant challenge. Next slide, please. So even before the arrival of the vaccines, as a healthcare organization, especially as a senior care organization, we recognized that we needed to change the behaviors of our staff. We saw that asymptomatic infections among our staff, we recognize that as the greatest threat of infection to our residents. After all, especially in the nursing home setting, and then with lockdowns, even in the assisted living settings, our residents weren't going out into the community. So if the virus was going to get there, it was going to come from somebody bringing it into the facility. And with no visitors, that left only our staff, or our staff primarily as an opportunity for infection. Additionally, when our staff became infected, not only was it a risk for our residents, the quarantine requirements creates staffing challenges. So the more staff who are infected, the more have to be excluded from work, the greater burden on our staff. So we recognize that ahead of the introduction of the vaccine, that we needed a communication effort, a campaign to really reach our staff and help them understand that they needed to be hyper vigilant with regard to the precautions and protocols that they could take, including mask wearing and social distancing, avoiding crowds, et cetera, et cetera. Next slide, please. So we launched our Because I Care campaign to help change the behaviors among our staff and reduce the risk of contracting and spreading COVID-19. Next slide. So Elderwood and our affiliated companies have what we call our I Care values. It's an acronym that stands for integrity, collaboration, accountability, respect, and excellence. So we were using these as the cornerstone of our messaging to encourage behavioral changes among our staff. Next slide, please. So it was an internal campaign that included many elements, and many of these are the things that Dottie pointed out. So I'm glad to see that we hit some of the best practices and some of the recommended efforts to activate. Letters to the home. We had letters go to all of our associates' home, encouraging them to really avoid behaviors and opportunities for infections, reminding them as healthcare workers, they had a unique responsibility. I was really reminded when Dottie was speaking earlier about hitting the emotional triggers. Among the things that we shared with our staff was a letter that was received by one of our assisted living administrators. And it was a letter from a resident's daughter who was a retired public health nurse. And it was a plea from the daughter to the staff to encourage them to get vaccinated, reminding them of the safety and the efficacy, but also of the impact that their behaviors had not only on the residents and their coworkers, but on the families of their residents. One of the requirements, and this has since changed as it's evolving constantly, but for many months, we were under the requirement that whenever we had a new documented case of COVID-19 within a facility among residents or staff, all visitation needed to be suspended for 14 days. So this, and actually initially it was 28 days. It was backed off to 14 days. So this meant if our staff member tested positive, none of the residents of that facility would be able to receive in-person visitation. And this was really devastating for families. So when this letter came in, the administrator shared it with me, and we reached out to the family member and asked if it would be okay if we shared this letter, not just with the staff at that facility, but across all of our facilities. And we found this to be a very powerful communication. So I was glad that Dottie touched on that, the emotional triggers, because that's really important. We also did, the ubiquitous posters at all the facilities and wallpapered the place with messages and reminders. We did video. We think video is a really powerful tool. So we did messages to our staff and by our staff. So we did a campaign where we encouraged our staff members to record a short 15 to 20-second video stating why they're doing what they're doing. And all of the videos ended with the "Because I Care" tagline. It was really effective. We got not overwhelming participation in terms of the videos that were shared, but we got enough, and they were sometimes fun, sometimes poignant, and we were really happy to share that. We also had care packages that included masks and hand sanitizers, tips on staying safe, tips on staying away from crowds, card magnets, and we did a number of the on-screen reminders and tips as well. So we really tried to keep the message in front of people. Next slide, please. So these are just some of the messages that we shared. I believe these were some of our intranet screensavers and message of the day type thing. So there were a number of behaviors that we wanted to encourage and reinforce. Next slide, please. So the Because I Care program segued really nicely right into the vaccine rollout. So we continued our using our communications channels, including letters from our medical directors. Medical directors, unlike in a hospital, may not be on site every day. So they really carry a certain level of authority and respect and trust among the clinical staff. So we felt that a message from our medical directors, including a few videos from messages from our medical directors, was really important that we distributed to all of our staff across all of our facilities. We also included video messages from our ownership team, from our president, from our system-wide medical directors, from our chief nursing officer about getting vaccinated. We encourage peer-to-peer advocacy, and we think this is really where most of the inroads are going to be made. There are people who are entrenched in their belief, and there are people who, out of fear and really lack of understanding, who have not been vaccinated yet. We really think that their peers can influence them better really than their boss or a poster or an email reminder. So we're really trying to attack it from all aspects. In our setting, we were fortunate that we were among the first organizations to receive access to the vaccine. So the federal government facilitated vaccine clinics at all senior care facilities across the country. And locally, that opened up vaccines to not only our residents, but to our staff at the facility. It was effective in getting the first people who were going to get vaccinated done right away. It allowed some of the staff who were hesitant to see that there were no serious side effects or any downsides, and really to see the benefit of vaccinations. We saw that what I found particularly and personally encouraging was after the 2 weeks to 3 weeks after those vaccinations of our residents and good numbers of our staff, we saw the number of COVID cases in our facilities literally fall off the table, which was stunning. And that I think sent as positive a message as anything. So during those initial COVID vaccine clinics at our facilities, we jumped right on top of that, and we had social media frames available for people's profile pictures. We had selfie backdrops at all of our facilities so people could take a selfie immediately after they got their vaccine. And then we also introduced the vaccine compliance contest. So there's the carrot and there's the stick. And our carrot is a $2,500 cash award that will be awarded to staff members selected at random, but there are two caveats. So the staff member who's going to receive the award, as you might imagine, needs to be fully vaccinated. Not only do they need to be fully vaccinated, but the facility at which they work, there needs to be an 80% vaccination rate among staff. So across all of our senior care facilities, our pediatric care facilities, in other clinical settings, our staffing support services for clinical workers are also eligible. They need to be vaccinated, and their friends need to be vaccinated too in order to be eligible. So we're really underscoring the fact that this is both an individual effort and a community effort as well. Next slide, please. So in terms of activating the campaign, again, using a lot of the traditional campaign channels, we had a special newsletter. As you can see there, there's our note from our medical directors, information, education, promotion. That little circle graphic there is a sticker that we gave to everybody as soon as they were vaccinated at our on-site clinics. And we continue to push this forward on a day-to-day basis. It's a kind of thing that we need to be constantly engaged with our staff. Next slide, please. So where are we? I thought this was timely because for Buffalo News readers, you'll notice the story in yesterday's Buffalo News that looked at New York State vaccination rates in nursing homes. So approximately 39% of long-term care facility workers across New York State have been vaccinated. We're actually doing a little bit better across our continuum of care, which includes Vermont and Rhode Island as well on our senior care side. We're looking at about a 65% rate, which is still not good enough. We have an 80% goal. Naturally, we would love 100%. We realize that that's not going to happen, but we're looking to get that 80% goal by July 1st, in which case everyone who is vaccinated would be eligible to win that cash award. But we still have some challenges with that. In just looking at percentages and numbers, there is high turnover among healthcare workers. So we could easily, lose 3 staff members to retirement or to other opportunities. And those 3 healthcare workers could be vaccinated, and we could hire 3 healthcare workers to replace them, and they might be unvaccinated. So that changes your profile. And again, just a reminder, as we looked at those demographics, we employ a high percentage of individuals who have among the greatest vaccine hesitancy. So our challenge is real, it's significant, it's ongoing. But it's one that we're continuing to address. Next slide, please. And I believe that that concludes it, and I'd be willing to take any questions.
Chuck, thank you so much. It was great to see your really comprehensive campaign, and really you did follow what has become really best practices. The emotional connection is incredibly important, and it's a natural one in your place of work. Obviously, we all love our loved ones. So we do have a couple of questions, and I just want to comment that 65% with a population that has a high propensity to vaccine hesitancy is a remarkable number. When you look in our region, and I haven't looked at in the areas within Erie County that have the highest percentage of vaccination, I want to say that number is just north of 40% right now. So compared to the community at large, and then take into account the fact that you have a population that, for historical reasons and for other reasons, are worried about the vaccine, I think that's remarkable and can show the power of a plan as comprehensive as yours. So congratulations to you on that. It's really amazing.
Thanks,
so
Tony.
We've got a couple questions here. Let's see what we've got here. Let's start with the first question. It says, when creating the plan, I wondered if there are any exemption forms that orgs can have on hand for people who have already been vaccinated. This is mainly for visitors and external partners. So Chuck, I'll throw that to you, but I will say, for those of you that have not yet seen the state's Excelsior Pass, if you have been vaccinated, you can go, there's an app, you download it, you answer just a handful of questions, and you wind up getting in your phone, I don't know if you can really see this, to put into your wallet a QR code that shows that you have been vaccinated. So if people, encouraging people to use that would be a way, if you wanted to verify who's been vaccinated or not in your facility, the state's doing the verification for you in that way. So Chuck, do you have any other thoughts about this? I'll reread the question. When creating the plan, I wondered if there are any exemption forms that orgs can have on hand for people who have already been vaccinated. This is mainly for visitors or external partners. Is there anything you'd add to my answer there, Chuck?
Sure. I think what you mentioned with the Excelsior Pass is a great idea. Within our organization, in terms of visitors at our facilities, most of the regulations and guidance around visitation is regardless of vaccination. So there are limitations that people, have issues with and say, why can't I do this? I'm vaccinated. The guidance still really precludes that. So there are some situations where vaccines come into play, or vaccination comes into play, but it's generally on the resident side, and we know who's been vaccinated. So more often than not, we are not asking for proof of vaccination because it's simply not applicable. But when it comes down to it, the Excelsior Pass will play a role in that, and then the vaccine card, the proof of vaccination, will as well.
Your point is very well taken in that even if one is vaccinated, one can still contract COVID, although it's much less likely and it will be much less severe. Of all the people who are hospitalized in Erie County, or this was true as of last week, I haven't heard county executive's new report yet, but as of last week, there was not a single person who was hospitalized who had gone through the full vaccine protocol. But I know even in my own family, someone who was fully vaccinated who did contract COVID. So you're absolutely right. We still have to wear our masks. We still have to social distance until we get to herd immunity for sure. So Nicole wants to know, since you have a large number of employees and they are spread out through multiple locations, how did you communicate to staff who do not have email or do not check email regularly? For example, how did you make your videos accessible for staff to watch? Do you mail your newsletter to staff at their home address, etc.?
So we did have a number of home mailings. That's obviously not timely, and with the number of staff we have, there's also cost involved with that as well. What we do rely on is our leadership within our facilities to make these videos accessible. So, and we put them across a number of channels. So while not every nurse or not every aide has access to email, they do have access to our electronic health record. Many of them are documenting in there. And the home screen in the EHR allows us to have messages. So we can do that there, and we can reach a significant amount of staff that way, as well as we have an employee recognition tool called Kazoo that allows people to award points and recognize individuals across the system, that has a corresponding mobile app that virtually all of our staff have access to, and we can deliver video messages that way as well. So we've seen a lot of downloads, a lot of views that way. And then, as I said, the leadership within our facilities will have meetings and huddles. Some of the nurses simply pull up a video on their phone. Others will have it on a computer screen, or if it's a meeting, they'll have it on a projector. So we really encourage that kind of email chain type thing, where we ask our leadership within the facilities to share this with the staff that don't have access to email. The visual signs throughout the facilities as well, the posters and placards and things.
Well, I think, you're illustrating a point that we talked about earlier, which is you really need to look at how your employees interact and what access they have and how you do regularly communicate. And there is no one checklist, right? You really have to think very creatively, like you already have, and really take the time and energy to do that, Chuck. So it's commendable, again, the thought that you've put into really reaching your people. So the last question we have here is for you, Chuck. It says, how are you approaching new hires regarding vaccinations if they aren't yet vaccinated?
That's a good question, Dottie, and I can't speak definitively on that. I believe it's a question that's asked now. As a healthcare organization, all of our staff need to come in and meet certain healthcare requirements. Whether it's a TB test or a physical. So I believe that is in the questionnaire. There is no requirement for vaccination as a condition of employment. What we will do for all new staff members and all of our residents as well is that we make known that we will provide access to the vaccine for them. So all new staff members have access to COVID-19 vaccination within 14 days of employment.
Thank you so much. And thank you, Chuck, for your time. I want to remind folks that are listening that the entire Webisode series, all 3 parts, will be available on our resource and impacts page. And also the vaccine section of the page is divided into access, education, policy, and policy planning and communication to follow the same series session. So please visit the site there to get access to the sample communication templates and workbooks. And I think that will help you sort of get to where you want to be in your organization. I also want to thank Chuck Hayes of Elderwood for his time and expertise today, and their very thoughtful and impactful plan. And a final thank you to our series sponsor, Highmark Blue Cross Blue Shield, for helping us present this important conversation to our business community. Thank you to all of you who attended today's session and our series. And a reminder, if you have specific questions we haven't answered today, please use our BizLink form and we will get back to you as quickly as we can. So thank you all and have a great day and a wonderful weekend. Thank you, Chuck. Take care. Bye.